Hello, everyone, and happy Friday. Today we're going to be talking about dental forensics, what it is, how to help during an examination, and where to find our kits. So what is dental forensics? It's also known as forensic odontology. It's the application of dental sciences to aid in identifying the deceased in criminal and civil investigations, singular fatalities, or mass disasters. So why is dental identification used? It's used because everyone has individual uniqueness, nobody is the same, no restorations are exactly the same, and positive identification can happen with just a single tooth. Durability, enamel is the strongest material of the human body. Teeth can withstand decomposition, fire, or significant trauma. So how is a match made during it? It's used making a two-step identification. That's done administratively and radiographically. Administratively, it includes the hard copy dental record, dental charting, all the Air Force forms we will talk about. Radiographically, antemortem radiographs before death found in my PACS and record, and postmortem radiographs, everything taken after they have passed with the NOMAD. So who will be on a dental forensics team? The forensics team will be made up of, at a minimum, 2 doctors. Any technician can be asked to assist in the examination, so it's important to stay sharp on charting skills, admin skills, radiographic skills. Also be familiar where the forensics equipment is kept. So if a team were to get activated on our base, it would be done per the 56 Fighter Wings Mortuary Affairs Plan, which is also called the O Plan 34-1. The dental forensics team will be activated by the 56th Medical Group Commander as directed. The 56th Fighter Wing O Plan is the leading guidance on supporting the base mortuary officer during any events of terrorist attacks, peacetime disasters, natural causes, and aircraft mishaps. This plan can also be found in the Forensics Binder if you would like to reference it. So following a mass disaster and team activation, what happens is the identification center will be designated in an isolated area. The dental team will report to the identification center with all necessary equipment, which is the forensics kit and binder, which is located in dental logistics together, the NOMAD and laptop, also located in dental logistics. The probable victims list must be established, antemortem records compiled as quickly as possible and delivered to the identification center. Always follow the chain of command. Never release information without the med group commander's approval. The antemortem dental record is anything made of record prior to death. It is made up of the hard copy dental record, the Air Force Form 1802 antemortem charting, copies of all existing radiographs. All these documents must be placed in a sealed manila folder identified by name. An antemortem record must be made for all identified possible victims on the victims list. All folders must be kept secure until delivered to the identification center. The Air Force Form 1802 Antemortem Charting. Chart findings for each tooth using all written dental records and antemortem radiographs. Record any pertinent information such as tori, supernumerary teeth, tooth erosion or abrasion, etc. Utilize standard charting procedures and approved abbreviations. 2 members must review the form for accuracy prior to adding it to the record. So this is done by charting from everything existing before death. So that's by referencing the hard copy dental record and my PACS radiographs. So post-mortem radiographs. These radiographs will be taken using the NOMAD and its laptop located in dental logistics. A full mouth series will be captured. All apices and occlusal and incisal edges must be represented in at least one film. Always practice ALARA and practice safe shielding techniques. Only take radiographs on one individual at a time to prevent from mixing up the images. Sensor stabilization may require some creativity. Authorization to the remains for accessibility might be needed, but you may never do that unless the identification center chief has approved or disapproved alterations. And then burn the radiographs onto a single labeled CD for each individual. The Air Force Form 1801 postmortem charting will be accomplished on the deceased after death. It's much like the 1802, same steps, chart findings for each tooth using all visual and radiographic examinations, record any pertinent information such as tori, supernumerary teeth, etc. Utilize the standard charting procedures and approved abbreviations. Examiner 1 will state findings while Examiner 2 records findings, reverse roles, and repeat the process. Mirror image of the antemortem charting, but this will be accomplished on the deceased using the postmortem radiographs. Some factors to consider while doing the postmortem charting. Be sure to record missing teeth, both before death, after death, and due to trauma. Prosthetic appliances, they have unique features. Dentures often includes the owner's name. Any noted pathology, and it could give an age estimate, possible gender, or possible racial group. Then the Form 1802 will be compared side by side with the Form 1801. After the two forms are compared side by side, they will be used to fill out the Air Force Form 1803 Dental ID Summary Report. This is where they will chart corresponding findings from the 1802 and the 1801. It aids dentists in making positive identification of the individual. Once positive identification is made, it will be annotated accordingly. Then place all victim documentation together and secure it. All IDs are notified through the dental chief to the ID center chief. Do not release any information outside of this chain. If you have any questions, feel free to reach out to me via text or through the GroupMe app or through email. Thank you guys and have a wonderful weekend.